Do you feel like you got to take a nap at 3 o'clock every day? Well, I hear this day in and day out. Fatigue, energy, and whatever. It's all related to thyroid. And I hear people go to their primary doctor. They've gone to Dr. Google. Dr. Google says this. You've got a thyroid problem. They go to their primary doctor, and the primary doctor says, nope, your blood work says you're just fine. And I'm scratching my head when I hear that. I go, what do you mean my blood work is just fine? What's more important, me or that little black number on a white piece of paper? Well, they got it all wrong. That's not the way you do thyroid. The way you treat thyroid is to listen to people, to understand what's bothering them, to look at those symptoms and come up with a working diagnosis, and then make sense out of what the numbers are trying to say. Because you know what? Thyroid problems are a real concern in this country right now, and in fact, worldwide. If you've got fatigue, brain fog, energy deficits, you're gaining weight, you're increasing visceral fat, you've got sugar or cholesterol problems, and even erectile dysfunction in men have been directly tied to thyroid insufficiency. I want to be clear, I didn't say hypothyroidism. Hypothyroidism is a very specific diagnosis that requires a certain set of symptoms along with a blood level that's below the normal range on the lab slip. Well, you know what? The normal range on a lab slip doesn't mean anything. It's a statistical number that takes no consideration of how you feel, how you do, how your function is, and what your metabolism is. We need to look at thyroid as a functional hormone. It's a metabolic hormone. We need to have enough of the active hormone that's there to power your ability to do bodily functions every day, to keep your metabolism in top shape, to allow you to burn your fat, to keep you alert and oriented. And when you look at the active hormone and the amount of energy and the amount of symptom control that you have, it is very clear that thyroid insufficiency is a problem. Now, what do I mean by thyroid insufficiency? I mean, you may have a normal amount of thyroid, but what you do have is insufficient to give you the thyroid symptom relief that you need. And what we see is when we look at the range of thyroid hormone for the active hormone of an 18-year-old, it's almost twice the range of a 50-year-old. So what does that mean for you? It means that normally, don't you think that an 18-year-old has more energy, they're more fit, they're more trim? On balance, that's going to be the case. Why? Because they're allowed to have a little bit of a higher thyroid level, because when you take that statistical range, you find out that it is far higher than a 50-year-old. And another thing, a 50-year-old is far less sensitive to thyroid. That means for any given level of thyroid, their body does not respond the same way it would as a younger person. Why? Because they've lived 50 years, they've got environmental toxicity, radiation, genetic problems, they've got receptor sensitivity issues, and there's all kinds of reasons why to explain that a certain amount of thyroid hormone doesn't produce the expected result. So when you look at thyroid, you have to look at it from a functional standpoint. You have to understand that you may need more thyroid to power those receptors to get the response that you want. And when you look at it that way, now all of a sudden it becomes important to listen to the patient and say, do they have thyroid symptoms? And yes, if they do, there's nothing wrong with trialing a dose of thyroid to see if they get improvement in their symptoms. And guess what? Lo and behold, over 90% of the time when people are in this office and they say, well, my doctor said my thyroid is fine, and I discussed with them thyroid insufficiency, they then understand that they may have a normal thyroid blood test, but they don't have enough thyroid in their body to power their body's needs. And when you get that, you completely understand that giving some thyroid is very helpful and beneficial. Why? Because I know by reading the literature that there is a certain amount of thyroid that I can give very safely, and it's far above what everyday doctors think. That is, when you go to the literature and you find out the various specialties like ear, nose, and throat treating thyroid cancer, and psychiatry treating anxiety and depression, can use 5, 6, or 7 times the amount of thyroid that I typically use in this office for my patients and get great results with, that they can use many times the amount of thyroid that I use with no fatal or significant medical consequences. I then know that I can use more thyroid than the everyday doctor does safely and effectively as long as we monitor it. So it's really important. If you have thyroid symptoms such as brain fog, fatigue, energy deficits, overweight, cholesterol, sugar problems, and as I said, even erectile dysfunction in men, thyroid might be the answer, and it's always worth it to seek out an expert who really understands thyroid. Now, I want to point out a book to you that I love. It's a book called Rethinking Hypothyroidism. This book was written by a guy named Antonio Bianco, and he used to be the president of the American Thyroid Association. Now, none of you may have heard of that association, but it's one of the most anti-functional medicine associations out there. And the American Thyroid Association is 100% into treating numbers and 0% into treating people. As a matter of fact, they're one of the most antagonistic societies against the functional approach to thyroid. When he got done being president, he woke up and he started listening to his patients. He needed a complete 180. He says, wait a minute, us traditionalists are doing thyroid all wrong. We need to start taking a functional approach. And he came around to the dark side, if you will, and he starts to understand now that treating people's symptoms and understanding looking at the active hormone, that is free T3, in relation to those symptoms, which is prevalent in the literature over the last 10 to 15 years, is the way to go. So even the former president of the American Thyroid Association now understands that listening to people, treating symptoms, and using as much thyroid as necessary to make them feel good is the way to go. So when we look at thyroid, we're not only looking at the traditional TSH, which is really not a very good test for monitoring thyroid treatment. We're looking at the active hormone free T3. We're looking at thyroid antibodies to see if you've got autoimmune thyroiditis. And we're using these functional ranges in terms of what they need to be in order to get the results in your body. So with a new approach to thyroid, we're seeing complete reversals. I saw someone earlier today in the office and they said, doctor, with your thyroid, you've changed my life. I'm more energetic, I'm alert, I'm able to focus and concentrate. I can get up and I can keep up with my kids, and I'm doing far better than I ever did. And you know what? When I do the things I need to do, I now see results on the scale. That is, my weight is going down, I'm getting better, I'm healthier, I'm more active. Thyroid is not treating a number on a piece of paper. Thyroid is doing it the Marcus Welby way. Listen to your patient, come up with a plan, institute that plan, monitor it with the numbers, but don't let the numbers guide your care. This is Dr. John Carrozzella from the Florida Center for Hormones and Wellness. I hope you found this useful.